28-year-old woman attended the colposcopy clinic after an abnormal smear test. The smear is reported as severe dyskaryosis. She has a previous normal result at age 25 years. No postcoital or intermenstrual bleeding. Her first sexual relationship started at age of 14. She has had several partners since then. She lived with her current partner, who has been with for 3 years. She was diagnosed with genital herpes years ago, but there wasn't any attack for at least 3 years. She smokes 15 to 20 cigarettes per day, drinks only at the weekend. She has an intrauterine contraceptive device in situ.
طب خلينا على السلايد هذا سلايد مش هيك؟ Yeah, would you like to comment an overall impression about this woman? يعني أنت لما تقولي postcoital intermenstrual bleeding, this is interesting. You're talking about the signs of cervical malignancy, early intercourse at the age of 14.
دكتور كمان multiple partner.
Exactly. لاحظوا the lifestyle of this woman. Whoever questioned this woman to take the history has some ideas in his or her mind. Why do you ask about the age of first intercourse? Why? Multiple partners. Why are you interested in this? She smokes. Why is this? Why do you ask her whether she smokes or not? So can you elaborate on those elements? بتول؟
دكتور.
شو رأيك هذول؟ Why do you have to tell us? Why do you have to give us this detail?
Because she have abnormal smear test.
Okay.
And ولازم نسأل عن the risk factor.
Yes. Tell us more about the risk factors.
Smoking, وهي عندها أصلاً genital herpes و multiple partners.
Herpes. What does cause herpes? Herpes simplex virus? Yes.
Dr. STD.
Sexually transmitted infection. Is herpes important in this case?
دكتور مهم.
Why? Does herpes cause cervical cancer?
No, it's a risk factor for cervical cancer.
What causes cervical cancer?
Mostly HPV, human papillomavirus.
Well, is HPV and herpes virus the same?
No, different.
No, they are different. So why are we talking about herpes here when it does not cause cervical cancer?
Doctor, because maybe when she has one STD caused by one microorganism, this is a risk factor for other.
Exactly. That's why. واللي حكاها أظن عمار. أنا دائما بخربط عامر وعمار. عمار ها؟ أظن عمار اللي حكى؟
لا حلا.
حمزة معك.
حمزة وحلا دكتور.
وحلا. أوكي حمزة اللي قال sexually transmitted infections. Yes. طيب هاي واحدة. she started intercourse at the age of 14. She had several partners. يعني هي highly exposed لل TIs. Yeah, smokes and drinks. All especially smoking, yeah, risk factors. Okay, and she has an IUCD in situ. We don't know about her parity. We don't know whether she's given birth. She is 28. We don't know whether she has any children. Why am I asking about children?
Because parity more than 3.
Because early age of first birth and multiple parities are also risk factors for cervical cancer.
Yeah,
It is a protective factor.
really is nothing to do directly with this, but if she is nulliparous, has never had any children, well, for a start, she is sexually quite active, this woman. So she needs contraception if she doesn't wish to get pregnant. If she has no children, maybe an IUCD is not ideal. It's not ideal for a woman who's never had any children. Why? Because if I compare it with other methods of contraception, relatively speaking, and I stress relatively speaking, IUCD is more likely to cause pelvic inflammatory disease, i.e. tubal blockages. In a woman who is quite liberal in her sexual lifestyle, she's quite likely to have salpingitis. So that's not very good for her future fertility. Okay, let's carry on, please.
Examination. The cervix is microscopically normal. The colposcopy acetic acid is applied on and an irregular white area is apparent to the left of the OS. Lugol's iodine is applied and the same area stained pale white. The rest of the cervix stained dark brown. Investigations.
خلينا على examination. Tell us what is acetic acid, how it works, what is Lugol's iodine, and how it works. Is aceto white a good thing or a bad thing? Or dark brown with Lugol's iodine, is this good or a bad thing?
Lugol's iodine normal إنه يطلع حتى black أنا قرأت.
Yeah, okay.
أما إذا طلع إشي فيه زي هون إنه white pale white بيكون إنه السيرفايكل.
So both acetic acid and Lugol's iodine differentiates healthy tissues from unhealthy ones. But one makes things white and the other makes them dark. How? Why? And what is the significance?
Acetic acid stained the abnormal area.
Yes, correct. How does it do that?
Or it washes the mucus and allows abnormal areas to be seen.
Yes. Yeah, but what does it do to the abnormal areas so they can be seen? It does something. Acetic acid هو vinegar, 5% acetic acid. It stains abnormal areas white. how coagulation, it coagulates intracellular and nuclear proteins. And when زي بياض البيض, you know, it's colorless, but then it becomes white when it coagulates. And that's how acetic acid works. It coagulates the cytoplasm of abnormal cells. And if you see acetowhite at colposcopy with acetic acid, then this is the area you want to biopsy. When it comes to Lugol's iodine, what is the composition of Lugol's iodine? What is Lugol's iodine? It's a mixture of iodine and potassium iodide. And it stains, this is the opposite. It stains the healthy epithelium dark. Okay? Do you get the distinction here? Dark, like dark brown or black. And the area that stains dark is the healthy area. So you biopsy the unstained if you're using Lugol's iodine. And how does Lugol's iodine, how does it, why do cells become dark with iodine?
دكتور لأنه بصير في cell death.
It works on it works on what? On glycogen, on the cellular glycogen. It reacts with the glycogen of the cells, and the glycogen turns black, dark. Okay, so one coagulates the proteins and the other one interacts with the glycogen. Of course, these are trials and errors before they were discovered. Okay, so these are, what is colposcopy? What is colposcopy? How do you colposcope?
It is done to examine the cervix, Doctor.
Yes, it's a microscope. What is the magnification of this apparatus? You magnify the cervix. How many times can you magnify?
10 times.
50.
Yeah. It has a range. It's up to you. You can, it's like a microscope. You can turn on the magnification, and it can be anything between 5 and 20 times. When I ever have used the colposcope, I think a magnification of 6-8 times is good enough. So it's not like a microscope is more gross than that. It does not magnify 100 times, 5 to 20. Um, do you, what, how, what position does the woman adopt to be colposcoped? And do you need anesthesia?
دكتور لا ما بتحتاج انستيزيا.
Correct. No anesthesia.
بالاوت بيشنت.
Sorry?
ما بتحتاج لانها
No anesthesia. No anesthesia on a conscious patient. You don't even need sedation. What is the position you put the patient in to do this?
أتوقع lithotomy.
Lithotomy, huh? Lithotomy. You know what is lithotomy position?
Doctor, when the hip and the knees both flexed with the hip abducted.
Correct. External, yes, abducted or external rotation. Why is it called lithotomy? Interesting. Lithotomy.
عشان it was used زمان عشان lithotomy procedures لما يكون في stones.
Bravo. Yes, very good. Litho is something to do with stones. So in the older days, probably they used to put the patients in such a position to deal with their stones somehow. Just interesting historical clue. All right. So it's a bit of an undignified position to be in, especially if you are conscious, but this is how life goes. You put the patient in lithotomy position, you drape her, and you introduce a casco speculum to expose the cervix. Then the colposcope does not go inside the woman's vagina, it's from outside. You direct the light to the cervix and you put the magnification that you want and you're comfortable with, and then you get rid of any mucus on the cervix, you inspect it carefully, and then you apply acetic acid, you look for aceto-white lesions, and you look for other abnormalities, abnormal blood vessel pattern, ulcers, just a good inspection. Then acetic acid, biopsy, then Lugol's iodine. You don't have to use both, but if you like, you can use them both, acetic acid and Lugol's iodine. Then you come to the corposcopically directed biopsy, because the cervical smear tells you there are abnormal cells, but it doesn't tell you where they are. The colposcopy will help you locate the pathological areas from which you take a biopsy. How do you take a biopsy? They've taken 4 by 2 millimeters biopsy.
أكمل دكتور.
How do you take the biopsy?
Investigation cervical biopsy report. The sample received measures 4 millimeter and 2 millimeter and contains enlarged cell with irregular nuclei consistent with
CIN3. How do you take the biopsy? They've taken a biopsy. How did they do it?
يا إما punch biopsy, cone biopsy. في عنا endo cervical curettage.
Yes. Hey, this particular one is not cone biopsy. This is punch biopsy. Good, punch. There is a special instrument that bites onto the cervix, bites onto it, and it excises a small bit, like this one, 4 by 2 millimeters. This is slightly painful, slightly painful. Would it cause bleeding? Would it cause any bleeding?
أتوقع دكتور إنه بتعمل bleeding.
أكيد بتعمل absolutely. كيف 4 مليمترز وين في الجسم 4 مليمترز sample you take without causing any bleeding إلا إذا بتحكي عن شعر وظافر. Anywhere else if you take 4 millimeters of any flesh it will bleed. You have to be prepared for this. So how do you stop the bleeding? Remember, this patient is conscious and you've taken 4 millimeters of her cervix.
دكتور ممكن بيعملوا cauterization؟
Yes. Yes. Cautery, diathermy, or silver nitrate. Too, it coagulates bleeding. Bleeders, capillaries. Good. Okay. So she turned out to have CIN3. What does CIN stand for?
Abnormal cell line of the cervix.
Yeah, cervical intraepithelial neoplasia. Cervical intraepithelial neoplasia. Okay, next slide, please.
The colposcopy findings show an abnormal area on the left of the cervix. The diagnosis is cervical intraepithelial neoplasia. Next slide. Management. Cervical intraepithelial neoplasia needs to be treated to prevent progression over several years to cervical carcinoma. The commonest treatment is large loop excision of the transformation zone, removal of abnormal cervical tissue with diathermy loop. Most women tolerate this under local anesthetic. The sample needs to be examined histologically to confirm removal of all abnormal tissue. Follow-up smear should be done in 6 months and thereafter yearly smear for 10 years.
Okay, Khalil, let us look at this slide. CIN needs to be treated to prevent progression over several years. Okay, so, and I am on call, so I'm going to answer this phone call.
تمام دكتور علي.
Yeah. Actually, I'll put her on the loudspeaker. شذا دكتورة شذا. صباح الخير. دكتورة شذا, if you don't mind, أنا مع طلاب السنة الخامسة وأنا حاطك على السبيكر.
Okay, دكتور.
So they will benefit from our conversation.
Okay, تمام. صباح الخير للجميع.
هاي بتقولكم صباح الخير.
دكتور زاهد بدي احكي لك على المرضى تبعونا.
اوكي.
في في عندك اول شيء سلسبيلا البوست اوربيتال فالجكتومي اللي كانت اكتوبيك بريجنسي اللي هي الكوفيد بيشنت. اليوم امورها ستيبل باس وامورها كل شيء تمام، فاي ويل ديسشارج هير وراح احكي لها ترجع ترن لنا تليفون عشان تشيك الهيستوباثولوجي.
اوكي
دكتور في لك مريضه اسمها براء بوست سيزاريان داي 2. المريضه امورها كويسه، هيموجلوبين هي بوزيتيف بلاد جروب، هيموجلوبين من 13 ل 10 3 باس ودريسنج دون وبرضه اي ويل ديسشارج ذا بيشنت.
Okay, she is second day?
Yes, she is second day.
I like to keep them 3 days.
هي عم تطلب انها
غالبا راح تقول لك لا بدي اروح خليها توقع. The other thing, what about anticoagulation?
دكتور هي عمرها 26 para 3. I think 14 days.
Yeah, para 3 is a risk factor, yeah. Was it an elective or emergency?
والله صراحة I don't know, but بشيك الموضوع.
Let's say emergency 10 days. That's another risk factor. Okay.
إذا دكتور إذا هي emergency إيش؟
The emergency as compared to elective, it's a risk factor. It's a risk factor. يعني بتاخذ عليه علامة.
أوكي خلاص تمام. طيب دكتور بالنسبة لصفاء حكيت لك عنها عبير اللي هي pregnancy of unknown location، رح نعطيها ميثوتروكسيت ورح ترجع تعيد البيتا اس جي الأحد والأربعاء القادم على day 4 و day 7 وشرحناها عن الكومبليكيشن اوف بيتا اس جي، بس we are waiting انه يطلع بعدين نعطيها اياه.
اوكي.
دكتور بالنسبة لديما اللي هي ovarian cyst عبير برضه سلمتني عليها، بس يطلع يجهز البلد we will give blood ونماثيك ديفايس وكليكسال ما رح نعطيه، بكره بنشوف بنحكي لك عن الموضوع.
جود.
والله دكتور اخر مريضه هي الاو اتش اس اس المودريت او اتش.
نعم.
دكتور بالنسبه للمريضه كلينيكلي اليوم المريضه لوكس ويل، التكيكارديا اللي كانت امبارح اليوم يعني 105، امبارح كانت 120.
نعم.
احسن. بالنسبه للتشست ما في شورتنس اوف بريث، ما في اي سيمبتومز، ابدومينال بين ما في، فوميتنج اختفى، اكلت وشربت عادي، امورها احسن يعني. بالنسبه للريزلتس برضه الريزلتس احسن، الهيموجلوبين كان امبارح 17 اليوم 13.6، هيماتوكريت كان 49 اليوم 39، بلاتلت كويسين، صوديوم وبوتاسيوم كويسين، كرياتينين برضه كويس، الالكترولايت كلها منيحه، اي اس سي واي اس سي مايلدلي اليفيتد 37 يعني ما فرقت كثير. هلا بالنسبه للالبومين كان امبارح 35 اليوم 27 لو.
يس.
اوكي. بالنسبه دكتور للويت امبارح كان 67 اليوم 67 نفس الشيء. الجير كان امبارح 91 اليوم 92 يعني نصفه مش كثير زايد.
91 صار 98؟
لا 91 صار 92.
اوكي.
بالنسبه للانبوت ماخذه 1530
يا
ومطلعه 350.
هاي بالساعة كم عند الدايوريسيس؟
ايش هو؟
per hour how many milliliters per hour her diuresis؟
مش عم بحسبوا هم per hour، عم بحسبوا التوتال.
بس التوتال
بس التوتال.
We need to know how many hours otherwise it is meaningless.
طيب اوكي رح اشوف هذا
يعني please make sure that is over 30 milliliters per hour. هاي شغلة قبل ما انسى we need to give her albumin.
اوكي. قديش دكتور الالبومين؟
Sorry?
قديش يعني كم امبول بدك؟
I think the vials we have are half the normal dose. So if you like to check it out, see how many, what is the dose per vial, and we normally give them 2, but maybe our vials we need to give them more, like 4, because they are half the dose. But please, if you check it for me, and we definitely need to give her albumin, and she's on Clexane.
من امبارح اعطيتها.
Yes, 40 milligrams.
هي نحيفة.
Okay. She does not need paracentesis.
I don't think. لهلا لا الأمور
No.
كويسة.
Okay. Good. So it's just really giving her albumin and carrying on with the same things. Now, when it comes to cabergoline, she was on cabergoline, and we decided not to give it, and we will not give it.
بس بدي احكي لك امبارح بعد ما دخلت رجعت فرجتني الميديكيشن ما كانش معها كل الميديكيشن. الدكتور اوريدي مشيها على الكابرجولين من يوم الاي تي.
Yes.
من يوم الاحد ماشي عليه. بحب اوقفه ولا خلص تكمل على اللي هو مشيه كان عليه.
Yeah, but it's normally used for only 7 days.
7 to 10 days, yes.
Yes. How many days of it has she had?
احد 2 3 واليوم الرابع اليوم.
بس صار في interruption.
لا امبارح
أخذته خلص. Then carry on for 7 days.
نكمل 7 days.
Yes.
Okay.
What is the dose?
كابرجولين?
Yes. 25 0.5 ولا 25?
0.5.
نص ملغرام. Okay. Fine.
ماشي. بس عشان اليورين اوتبوت هلا بالنسبه لهم هي بس بتجمع بعينه ما بتعطي غير اول فاذا بدنا نعرف اولي هيك we should put for catheter.
No.
يعني أنا
Yeah, we would not. No. I did not mean. It's from the time she started collecting until now. How many hours? Very simple.
خلص تمام.
Yeah. No. And look at the color of it. If it's not too dark, then it's fine.
Okay.
Just to get a rough idea.
Okay. تمام.
Yeah. Okay. Lovely.
يعطيك العافية دكتور.
الله يعافيك. Thank you very much, Dr. Shah.
Welcome. Bye.
Hello my friends.
معك دكتور.
هلا دكتور.
كان صوت الدكتورة واضح؟
دكتور.
كويس. في عندكم أي أسئلة على اللي حكت لي إياه الدكتورة؟ حكت عن حالة ectopic pregnancy. حكت عن حالتين ectopic pregnancy. واحدة نعملها salpingectomy وبدها تروح. واحدة we're gonna give her methotrexate ectopic pregnancy. ممكن تسألوا ليش واحدة عملتوا salpingectomy والثانية بدك تعطيها methotrexate. Do you know the answer to this?
Yes, دكتور.
Yeah, tell me.
دكتور
حمزة؟ حسن إيش؟
حسن زواهرة.
سيد حسن. ليش واحدة عملنا لها salpingectomy وواحدة medical treatment؟
دكتور I think السلبنجكتومي إنه إحنا عرفنا وين يعني الامبريو في الفالوبيان تيوب يعني فقررنا نشيله. اما الثانيه الميديكال تريتمنت يوم عملنا الانفستيجيشن ما شفناش يعني الامبريو فاعتبرناها انون يعني لوكيشن فاعطيناها الميثوتريكسيت. يعني I think so.
Yeah.
Maybe to save fertility, we give medical.
How do you treat ectopic pregnancy? Three modalities. 3 طرق. 3 ways. عمار.
دكتور معك.
وانا بحكي مع الدكتوره طلعت بقول ظل معنا 8 دقائق.
هسه معنا دقيقة دكتور.
يلا
نسكر.
خلينا نسكر ونفتح من جديد
ان شاء الله. يعطيك